Assalamualaikum and hi. We are from Group 11 and we will be presenting about intermittent fasting.
Intermittent fasting is an eating plan that switches between fasting and eating on a regular schedule. With intermittent fasting, you only eat during a specific time. Fasting for a certain number of hours each day or eating just one meal a couple days a week can help your body burn fat. And scientific evidence points to some health benefits as well. There are several different ways to do intermittent fasting, but they are all based on choosing regular time periods to eat and fast. For instance, you might try eating only during an 8-hour period each day and fast for the remainder.
We will move on to the principles of intermittent fasting. The first one is fasting for 12 or 16 hours a day. This method includes the period of sleep in the fasting window. For example, a person can choose to fast between 7 p.m. to 7 a.m. So, their last meal will be on 7 p.m. Meanwhile, fasting for 16 hours a day is called 16-8 method, where people will fast for 16 hours a day and leaving an eating window of 8 hours. In addition, a study shows that fasting for 10 to 16 hours can help to encourage body weight loss, as the body will turn the fat stores into energy. Next is the alternate day fasting. In this method, people will fast occasionally. However, a study shows that this method of intermittent fasting is not effective at weight loss or weight maintenance. Thus, it is not recommended for beginners.
Okay, next is 5-2 ratio diet. Typically, you eat 5 days of the week and receive calorie intake about 5 to 600 for 2 days of the week. For example, you might eat normally every day of the week except Mondays and Thursdays. So for those 2 days, you eat 2 small meals of 250 calories each for women and 300 calories each for men. Lastly, the warrior diet is an extreme form of intermittent fasting. How they diet? They eat very little, usually just a few servings of raw fruits and vegetables during a 20-hour fasting window. Then they eating one large meal at night. So during 4-hour eating phase, people should make sure that they consume plenty of vegetables, protein, and helpful fats. They should also include some carbohydrates too.
Next, it is about the advantages of intermittent fasting, where the first one is it promotes weight loss. We are not consuming calories when we are fasting, so it makes sense to assume that by eating less than usual, we will lose weight. According to a study, intermittent fasting can cause weight loss over 3 to 24 weeks of 3 to 8%. For example, young men who are fasting for 16 hours show fat loss while maintaining muscle mass. Hence, this diet has the potential to be a very powerful weight loss tool.
Second, promote healthy brain function. Fasting increases the rate of nutrients in the brain, which is the growth and development of new brain cell and nerve tissue. Foregoing food challenge, the brain encourages it to take preventive measure against diseases. This is attributed to the body going into ketosis, which is a process that uses fat as a fuel source to boost energy and banish brain fog.
The other advantages of intermittent fasting is it can help to reduce insulin resistance and lowering risk for type 2 diabetes. Type 2 diabetes has become a very common diagnosis in recent decades. Anything that reduces insulin resistance should help lower blood sugar level and protect against type 2 diabetes. Interestingly, intermittent fasting has been shown to have major benefit for insulin resistance and to lead to an impressive reductions in blood sugar levels.
Even though we can see intermittent fasting have their benefits, it can also cause harm for people that take the intermittent fasting. One of it is it can cause headache or dizzy. This is because long periods of fasting can lower your blood sugar levels, and this will make you feel lightheaded, dizzy, or nausea. Your body will need some time to adjust, so individual can try choosing a day of the week that you don't need to be very active to practice intermittent fasting.
Okay, so for the second disadvantages is low blood sugar or hypoglycemia can occur during periods of calorie restriction or over periods of fasting. This can lead to irritability, anxiety, and poor concentration. Some people may experience irritability and other mood disturbance when they practice intermittent fasting. When your blood sugar is low, it may cause you to feel irritated.
Next, intermittent fasting may lead to sleep disturbances. This is because for some people, they will face restlessness at night, and this can cause tiredness during the day. This is proof on a 2020 study 21,422 people participated in fasting regimens lasting 4 to 21 days. This study found that 15% of participants reported sleep disturbances related to fasting.
To conclude, intermittent fasting is a diet that alternates between fasting and eating on a regular basis. Regardless of the body mass index, intermittent fasting was proven to be effective in lowering weight. However, just like any kinds of diet, it has its own pros and cons. Intermittent fasting may have different effects on different people. To be safe, one should consult a medical professional first before going for the intermittent fasting.